All right. So today, whatever we do, each step, I wanted to make a note of it in the back of your minds. Then I'll discuss it at the end. Okay. So let's get into it. Let's start with the case note. Here we go. So first, let's familiarize ourselves with the case note. Okay. Here we go. All right. Okay. Let's please get ready. Adjust your screens and everything. Okay. 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 All right. Get ready. 1 second. Okay, all right. So let's start with, so whenever, okay, I want all of you to do is, I want you guys to read this sentence. All of you, please read the sentence. All of you. What I've highlighted, nothing more, nothing less. All of you. Read that particular sentence. Okay, all right. So Saina, who is our patient here, according to that paragraph? Who is our patient? Mr. Tej Singh. And what is your role as a writer?
Head nurse.
Head nurse. So you as a head nurse are going to write the letter and your patient's name is Mr. Tej Singh. Okay, perfect. Now let's read the writing task. Okay, all right. So I want all of you to take a second, read the writing task. Nothing more, nothing less, just the writing task. Those who are joined, just read the writing task. Okay, all right. Sindhu, okay, not Sindhu. Radhika, can you tell me what type of letter have they asked us to write here? What type of letter have they asked us to write?
Ma'am, this is referral letter.
So they have asked us to come up with a referral letter. And who is our reader, Radhika?
An ophthalmologist, Dr. John Dyer.
Okay, yes, Amanju, you are also correct. We are writing to an ophthalmologist, Dr. John Dyer. Okay, so go through the task and tell me, in the writing task, have they given our purpose? Have they given our purpose for what we are writing the letter, or what do we want from the reader? Have they clearly given it in the writing task?
For further evaluation and management.
No, in the writing task. I'm asking you to look at the writing task. In the writing task, have they given that? Radhika, my question is, in the writing task, have they given the purpose?
No, ma'am.
No. Okay. All right. So yes, you guys are correct. They have given the purpose at the end, and the purpose is for further evaluation and management. That is correct. Okay. So usually in an official case note, you get your purpose at two places, either in the writing task or at the end of the case note. Okay. So here in the writing task, they only asked us to request the doctor to look into the case. For what is the purpose? What should the reader do exactly? That is given just above the writing task towards the end of the case note. Okay, so basically, so far we know our patient is Mr. Tej Singh. We know that as a writer, our role is that of a head nurse. We know we are writing a referral letter, and we know our reader is Dr. John Dyer, who is an ophthalmologist. And purpose is given at the end, that is further evaluation and management. Okay. All right, now let's read the case note. We are not selecting information. We are doing nothing like that. We are just going to read the case note. Okay, all right. So I want all of you to get ready. Okay, so go through from here till here. All of you. All of you. Don't worry about selecting anything. Just read and understand. Do nothing, just read. Just read and understand. Take your time. Okay, all right. So, Saina, what is our patient's full name? What is our patient's full name, Saina?
Mr. Tesing Randava.
Mr. Thet Singh Randhawa. Okay, and I want all of you to take a second, go through today's date. Today's date is 31 January 2017. That's when you're writing the letter. Okay, all right. So, and you've gone through everything. And Saina, what is the meaning of the word teetotaler?
Alcoholic.
Not alcoholic. A person
alcoholic,
no
not
alcohol.
alcoholic.
A person who doesn't drink. Okay, remember for this, for your speaking as well, if even when you're speaking module or even in your reading part C, listening part C, if someone says somebody is a teetotaler, that means that person does not drink alcohol beverages. Okay, they do not drink alcohol beverages. Okay, all right. Okay, now all right, 1 second. Yes, okay. So any other words or phrases? Are you clear so far? Yes, so far the case note is clear to all of you. Any doubts from here to here? Any words or any phrases? Okay, perfect. Okay, now I want you guys to read the 10th, what happened on 10th January, all of you. What happened from here till here, all of you. Go through it. Don't worry about selecting information. Don't think like, just read and understand. Understand the meaning, understand the content. Make sure that you understand the headings as well. Headings, date, everything. Right, okay, all right. So Manju, if you don't mind, can you unmute yourself if that's okay?
Yes, ma'am. Good morning, ma'am.
Morning, Manju. Can I ask you one thing? On 10th January, when Mr. Randhawa came to your clinic, what complaints did he have?
Ma'am, he told headache, right side, no cough.
Okay, so
No
so Manju, what were not there? We don't need to worry. Worry about the
Okay.
complaints. So headache, as Manju told us,
right side.
right-sided headache. Anything else?
Complaint with a significant nasal drainage also, ma'am.
Yes, correct. Significant nasal discharge. So one problem was headache, another was nasal discharge. What about his BP, pulse, temperature? Were all those normal?
Yes, ma'am. BP
Okay.
is not. BP is little bit elevated, 130/70. Temperature also elevated, 101 Fahrenheit. They done neuro exam, that was normal.
Okay. And what was the assessment on that day? What was the assessment that they made on that day?
Infectious sinusitis, ma'am.
Okay. And how was it treated or how was it managed?
They planned for augmentin treatment, ma'am.
Okay.
Amoxicillin or
Amoxicillin. Okay. Let me ask you one more thing, Manju. So we have
Yes,
assessment, we have plan, right? We have
Yes,
assessment. Among these two, which happened first?
First, they will done assessment, ma'am.
Okay, so this is the first event. This is the first event. Okay, I'm making a point related to tenses that we discussed this week. So keep that in mind. So this is the first event. So second event was which one?
They planned for augmentin treatment.
Augmentin. They gave augmentin. Okay, so all of you keep this in mind and think when you're writing this in a sentence, what times that you can use based on what we have discussed this week. Okay, all of you. Okay, there are two events. This is the first event. This is the second event. Okay, think about it. Which tense? Okay, all right. So all of us are clear with what happened on 10th January. So it's pretty straightforward. Now let's look at the second visit. Okay, second visit. All of you read from here till here. From here till here. All of you. Just read and understand. Don't worry about selecting information. So this is on 24th. Okay, make a note of the dates. Whenever you read, understand the dates. When what happened. So today was 31st. Earlier was 10th Jan. So now we are reading 24th Jan. Okay, all right. So Blessy, can you tell me what were the complaints, what were the problems that the patient had on his second visit?
Complaints of severe headache, right-sided.
Okay, so the headache, one second, Blessy, headache was severe. Headache, then what else? It was right-sided. Then what else?
Thrombing.
Throbbing. So Blessy, all of you focus here. It's not thrombing. Thrombing is a completely different word. Here the word is throbbing. Throbbing. Don't forget, don't make that mistake. Thrombing is different. This is throbbing. Okay. All right. Then what else was there about the headache, Blessy? It was severe. It was right-sided. It was throbbing. What else?
Radiating to right eye.
Radiating. It was moving from his right eye, teeth, jaw, and it lasted for 15 minutes to 2 hours. Okay, all right. Now, then what else? How else was the headache? Headache was?
Persistent.
It was persistent. Okay. Then how was the, then anything else that describes the headache?
Yes, it's intermittent episodes.
It was intermittent. So he had intermittent episodes of severe, persistent, throbbing, right-sided headache, and it was radiating to his right eye, teeth, and jaw, lasting for 15 minutes to 2 hours. Okay, all right. Okay. Now, okay. Any other complaint did he have other than the headache? Any other problem, Blessing?
Rhinorrhea.
Rhinorrhea. Okay, rhinorrhea is correct. Okay. Any other problem? Any other problem? Look at objective. Any other problem?
Pulse rate is slightly increased.
Pulse rate was elevated. Okay. Anything
and
else?
BP also elevated.
Slight elevation. Okay. What else? Anything much more, you know?
Neck tender.
Tender. His neck was tender on the right side. Okay.
Right.
And what was the assessment this time? What was the assessment?
Cluster headache.
Cluster headache. So the assessment was cluster headache. And how did we manage the cluster headache?
Given acetaminophen and non-steroidal anti-inflammatory.
Anti-inflammatory. Again, my question is, among these two events, Blessing, which one happened first?
Assessment.
Assessment. So this is the first event. I want all of you to think about the tense, especially those who have attended our previous sessions of this week. Please go through which tense. So I'm giving you a hint. This is the first event. This is the second event. Okay. All right. So which tense can we show off here? Which tense can we show off here to tell that, you know, to get scores on our grammar aspect? Okay. When it comes to your grammar. Okay. So which tense? We have two events. This happened first. This happened second. So which tense? Okay. All right. So we are clear with what happened on 24th. Now let's move on to the latest visit. Okay. Okay. All of you go through what happened on latest visit. Don't bother with associated with, just read it as with rhinorrhea. Okay, all right. Saina, what has so 29th? Okay, so today's date is 31st, so that means 29th means 2 days ago. 29th means 2 days ago, right? So we don't have what happened today, we have what happened 2 days ago. Okay, Saina, can you tell me what complaints did the patient have 2 days ago? What complaints?
Complaints of severe headache.
So the headaches were severe this time as well. What else? What else?
occurring in episodic attack with rhinorrhea and epipora.
So his headaches were severe and occurred in and the headaches were episodes and the headaches were severe. He had rhinorrhea and epiphora, and what else? What else? Sign up.
Right eye droopy and sometimes as
Droopy right eye. Droopy right eye and sunken eyelids. Okay. Anything else? Any other problem?
facial flushing.
Before and during headache. Any other problem?
Constriction of pupil of right eye in dark lighting.
Okay. Constriction of right pupil in dark lighting. Then what else? One more.
Decreased sweating on right side of face.
Okay, decreased sweating on right side of face. So what is the latest assessment? Right now, when you're writing the letter, what assessment are you, do you think that, currently what is the assessment?
Possibility of Horner syndrome.
So when I say possibility of Horner syndrome, are we sure what is the problem? Are we sure about it? Is it confirmed?
Suspected.
Suspected. So this is the yes, suspected. So it's a possibility of Horner syndrome. Okay. So we have read the case note. We know what happened on each visit. Okay. So we know who we are writing the letter to. We know the purpose. We have read the case note. Everything. Okay. 1 second. Let me just write down one word. So this is even though the data is of 2 days ago, even now we believe, right? With our suspicion is this, that the patient has Horner syndrome. So this is the current assessment. Okay, we can take that as current. Okay, all right. Now so we have read everything. We know the in depth what the case note is all about. Now let's select information. Select information that we are going to include in our letter. Okay, all right. So let me tell you one thing. Before I do that, can any one of you tell me, Smita, when in an OET letter, when I say one piece of information is relevant, what do I mean by relevant? What is the meaning of relevant?
What the reader knows. What is important for the reader is relevant.
Okay, and how will I determine if that is important to the reader or not? Based on what? Based on what will we decide that okay, this detail is important to this reader? How will we decide, Smita? On the basis of what? On the basis of? Think about it. You told me the meaning of relevant, which is correct. But my question is, how do you determine, on the basis of what do you determine that a piece of information is important to the reader? Manju, is it the role of the reader? What is it? Think about it. Is it about, okay, is it because the reader is an ophthalmologist that we will pick up a piece of information, or will we consider a piece of information relevant? Or is it something else? Come on, what do you guys think? Smita, Saina, Radhika, what do you guys think? You told me writing task. Is it writing task? Manju, right now you're correct. Purpose. Okay, I think when you said writing a task, you meant the purpose. So it's not about the role of the reader. Okay, when we select, so right now when we are selecting, you will tell me, ma'am, this piece of information is relevant on the basis of the purpose. So in order for our ophthalmologist to do further evaluation and management, should they need to know this particular piece of information? That's how we are going to approach it. Tell me, think about it again. So now if I want to pick a piece of information together, when we will select, we will think, does Dr. Dyer need to know this piece of information to provide further evaluation and management? That's going to be our thought process. Okay, and remember, when we are selecting, we will reject information if it has nothing, if we don't imagine what if, no what ifs. Does this piece of information affect what the reader is going to do for the patient? If our answer is no, we are going to reject it. Nothing in between, we are rejecting it. Okay, so in order for Dr. Dyer to provide evaluation and management for this particular patient, okay, one more question. Does the reader know the patient? Have they told that this is a known case or not anywhere?
No, unknown case.
No, so it's an unknown case. Okay, so this reader who has never met this patient, for them to provide further evaluation and management, what information do they need to know? So not on the role of the reader and who is the reader. That is a bit, less important compared to the purpose. On the basis of purpose, that's how we are going to decide the relevancy of that piece of information. So we are starting. I want all of you to work with me. Here we go. Okay, all right. Okay, give me a second. Let me just clear these note, everything out. So we have a fresh page to select. Okay, all right. So all of you, tell me from the first page. Okay, this is our first page. I will just zoom out so it's visible to all of you. Okay, from here, what will I take? What will I include in my letter? Consider the layout as well. Will I include my job as a writer? Will I include that in the letter? Should you say that?
Yes.
Yes, at the end we need to write, right? You are sincerely who? Okay, so we need that. So we are taking that piece of information. So we are including that. Okay, what about today's date?
Yes. Needed.
Yes, we need that. We need layout. Remember, layout carries 3.5 marks. So we need that. We need who we are as a writer, today's date. Now, under the heading patient details, what will be the things that you will include? Come on, tell me.
Patient name and date of birth, ma'am.
Okay, patient date and date of birth. I'll take that. But tell me, age is given. Why not age? Should I include age? Is it compulsory that I should include age? What is the
Ma'am,
date of birth, no need to write the age.
Okay, all right, correct. So when date of birth and age are given, or we always choose date of birth. Okay, and after you write date of birth, you're like, ma'am, I want to show the age as well. It's very important to me. You can write that if you're writing in the intro, but it's not necessary. I would say it's not needed. But there are I have seen many samples, even official samples, where they completely forget the age, or if they write it in the intro. Okay, but usually they say if you're writing the date of birth, you have date of birth and age given in your letter. To include in the layout, you always choose the date of birth. And if you want to write age again, then it's not needed. But if you want, you can write that in the intro. But I would say no need it. There is no need for it. Why? We have already taken the date of birth. Okay. Now, what about address? Is it relevant? Should I write the address?
no, ma'am.
No.
Okay.
No, ma'am.
Yes, perfect. So I'm rejecting it. Okay. Now, from medical history, what should the reader need to know in order to give further evaluation and management? Should we include anything from medical history?
Hypothyroidism.
Why hypothyroidism? Does it affect what the reader is going to do for the patient? Think about it. No, okay, once again, ma'am, we should include some medical history, right? It is a letter. No, that's not our approach. Remember, our approach is, should the reader know about anything? Should the reader know this piece of information to complete the purpose? Does any of this affect the reader's purpose? Think about it. Come on, think about it. No, the answer is no. No, in order to provide further evaluation and management, ophthalmologist, then if there was ocular history, imagine if there was some history regarding his eyes or ophthalmology or ocular history, then it would have been relevant, but nothing else, so reject it. Okay, don't be like, but what if? No what ifs. Okay, this is not going to affect what the reader is going to do for the patient, so no need. Okay, don't worry about it. Once we write, everything will be fine. Okay, don't be under the assumption that every letter I have to include something from the medical history. That is the wrong idea. Do not do that. If it's relevant, how do we determine if it's relevant? Whether the reader needs to know this to fulfill the purpose, only then write that. Okay, now I want all of you to go through social history. From social history, what should I include? Think of, go through it. About the patient's problem and go through the social history and tell me, should I include anything from social history? Plessy, Saina, Smita, others, go through it, come on. Yes, who was it? Yeah, tell me. Josh, you were saying?
That's a system analyst.
Okay, works as correct. All of you correct. Works as a systems analyst. So he has been having headaches, right? He's a person who spends a lot of time in front of a computer. So we need to inform that. So I'll take it. Remaining not needed. Remaining not needed. Systems analyst. Okay, systems analyst. Remaining you don't need to say it. Okay, all right. Whether he lives in his own home, whether he's a permanent resident, whether he has one daughter, all these are not going to affect what the reader is going to do for the patient. So we don't need to worry about it. Okay. So far, just go through what we have selected so far. All of you. Okay, all right. I'm moving on to 10th Jan. Okay, let's focus. Let me just zoom in so it's visible to all of you. Okay, so today's date is 31st. Okay, so today is 31st January. So whatever happened was this date is on 10th Jan. Okay, keep that in mind and tell me what are the things that I need to include from some under the heading here. Under these two headings, what are the things that I need to include?
Headache,
Headache, right-sided.
right-sided,
Headache accompanied with the significant nasal discharge.
Significant nasal discharge. So now, okay, let me tell you one thing. I would recommend not to write this pulse rate or BP. There is only slight variation. You don't need to include all these details because all these vital signs because today is 31st Jan. This happened on 10th Jan. Okay, so just saying headache and what symptoms they had, that's enough. Okay, and okay, one more thing. Manju, Smita, Jones, and others denied vomiting and nausea. What do we mean by that? What is the meaning of the word denied?
no vomiting.
No.
That is correct, but denied. What is the meaning of that verb? Deny. When you deny, what you are doing?
Refuse, ma'am.
No, that is a common confusion. It's not so. Okay, denied means do you have vomiting? No, I don't. So when somebody asks a yes or no question, and when you say no, that's called denial. Refusal is like, do you want it? When somebody asks, do you want something? That's when you reject it. That's called refusal.
Yes, ma'am.
They are two different things. Denial and refusal are two things. Don't get confused when, especially in your speaking. Okay, when somebody denies it, they say, no, I don't have it. No, I don't. That's what denial is. Okay, so we just took the symptoms, and I would say you don't need to write the vital signs because today is 31st. All this happened on 10. However, should I include assessment and plan? Come on, tell me.
Yes.
Yes, that is relevant. We need to tell. See, at first we thought this was the issue and we treated the patient like this. We need to tell that. So we took it. That's it. Okay. I'm moving on to 24th. Okay. I want all of you to focus on 24th. The visit on 24th. Tell me what are the things that I need to take.
Severe headache.
Okay. Once again. So yeah, Blessy, let me take about headache. Headache is severe. What else is told about headache?
Right-sided.
It's right-sided. The headache is right-sided. Okay. Severe. It is right-sided. Throbbing. Radiating. Okay.
Right side.
And yeah, lasting for 15 minutes to 2 hours. Persistent. And one more thing. Intermittent episodes. Okay, so I have given enough explanation about the headache. So should I say how the patient described it, like someone has put a hot poker? That's not needed because we told the headache is severe. We told the headache is right-sided. It's throbbing, it's radiating, it's persistent, it's intermittent. We have used enough adjectives to show how severe the headache was. So there is no need to tell this. However, if you want, you can use it, but I would say no need. It's clear cut how bad the headache was. Okay, then anything else, any other problem should I include? Go through it. Any other problem the patient had?
Pain.
Okay, once go through it carefully. One more thing, there is an error in the case note. When I send you, I will correct the error and I'll send you. See, this is not unstable, it's unable. Okay. Now, should I, this is a problem, right? The patient was not able to stand, sit. It was that bad. So include that as well. That would be good. Okay. Now, rhinorrhea. Another issue was rhinorrhea. Then neck tenderness on the right side. Okay. And if you want, you can include a slight variation in BP and pulse. But again, it happened on 24th. So all the vital signs, not necessary. But if you want, you can include. I wouldn't say it's wrong. Okay. Now, I should include the cluster, the plan and assessment, right? So that as well. Take a second, go through what we have selected from this page, all of you. The first two visit, whatever we have selected, just go through it. And if you have any question, please ask me. I rejected other piece of information because it's not going to affect what the reader is going to do for the patient. But the reader needs to know what were the problems and how did we deal with it. Because right now, we don't have a proper assessment. Currently, we don't know what exactly is the problem. So the reader needs to know what was the previous assessment and how we managed. Okay, so So Manju, Blessy, Smita, Sindhu, Pratima, Saina, Radhika, Shinu, Asma, Jose, Samson, and others, are you clear with what we have done so far? Do we have any questions about the things that we did so far?
Clear, ma'am.
Okay, perfect, perfect. Now we are moving on to the latest visit, that is on 29th. Of course, we need the 29th date, and from 29th, what are the things that we are going to select? Okay, I'll start with severe headaches. Should I say episodic attacks? Yeah, I should, right? Because it's the latest, even now, latest information is even now he has severe episodic attacks of severe headaches. Then what else? What other problems? Come on, tell me.
Rhinorrhea and
Epiphora. Then what else?
right eye droopy.
Right eye
and
droopy, sunken eyelid.
eyelid.
And if you want to talk about his wife noticed it, you can mention, not a problem. Okay, that's okay. Okay. Then facial flushing, right? When, before and during headache. Then this is repetition. Remember, in case note, that's a common feature of your case note. Same information will be repeated. See here, right eye droopy, it's already said. They've repeated it here. You don't need to repeat it. Okay, make sure that you don't do that. This is a common thing. Ma'am, one place it was subjective, another place it was objective. Okay, that brings me to Sindhu, Smita, Saina, and others. What do you mean by objective and subjective in a case note?
Subjective means
Subjective
patient is
Patient. Yeah, patient. Patient expressed it. Objective means?
That is subject. What we observe.
Objective,
what
what we find
what
out.
we observed. Okay, in one of the case notes in this next week or something when we discuss, there will be a slight change in this meaning. So keep this in mind. In these case notes, subjective means what patient said. Objective means what we observed as medical professionals. So subjective is usually objective is usually facts. Okay, all right. So we have already taken upper eyelid droopy. Then we can take constriction and decreased sweating. Okay. Then later, we need to say the possibility, right? That's it. That's it. We have selected all the relevant information. Okay. So all of you, take a second, go through it. Take a second, go through it. Okay. First page, what we have taken, go through it. Second page, what we have taken, go through it. You need to understand the approach that we did, every single step that we did. We will discuss, keep everything in mind. Okay, then everything that we need, we have selected. Now what we will be doing is we are going to worry about our introductory paragraph. So those who have attended Monday's session, they will know what should be the content of a good introductory paragraph. That was our discussion for that day. So if any of you have missed out on that class, you can get the recording by just contacting the institution and joining the course. You will be able to get the recording of that session on introductory paragraph. So we have selected the information. Now we are going to think about our introductory paragraph. Okay, so Saina, what are the two things that we need in our introductory paragraph? What is that one thing that comes to you? Okay, full name of the patient, that is there. Other than that, what is that one thing? What are the things that we need to include in our introductory paragraph? Come on, tell me. Purpose, you're correct. Purpose. One second. Let's not be in a rush. So here, what is the purpose here?
Further evaluation and management.
Purpose is what you want from the reader, that is further evaluation and management. Okay, so we will include that in our introductory paragraph. Then what else? What other information should we include? Just purpose, is it enough?
Present condition.
No. Did we say present condition? Think about it. How did we discuss? Is it the present condition?
Suspected.
That is the information, but I'm talking about the content. Purpose is further evaluation. What else should we include? Some. Okay, I want all of you to go through the session on Monday. Come on. Some latest. Smita, some latest relevant information about who?
Patient.
About the patient. Correct. Okay, let me tell you one thing. Never ever learn your content of the introductory paragraph like purpose and present condition. No, sometimes. So remember this, you need to write what you want from the reader and some latest information about the patient. So as you told, in this case note, that latest information is our suspicion of Horner syndrome. Okay, So it's not always, please don't be under the assumption that in an intro I'll always write purpose and the present condition. No, it depends on, if that present condition is the latest information, of course you can write it. So here you can write purpose and possible Horner syndrome. So take a second, all of you take a second, go through the content of an introductory paragraph. From now onwards, whenever I ask you what is the content, I don't want to say, ma'am, purpose and present condition. No. Purpose and some latest relevant information to the reader, about the patient, sorry, some latest relevant information about the patient. Okay, so, okay, let me rephrase that. So when you write an introductory paragraph, you're telling you the purpose should be immediately apparent. What do you want from the reader should be immediately understood. Then you cannot place some random information about the patient. That information should be latest, and it should be relevant to this purpose, and it should act as a starting point. It should act as a starting point. So the reader, you're introducing your patient's problem to your reader. Think about it like that. Sometimes that piece of information can be present condition, latest diagnosis. Sometimes it can be something that you take from social history. Sometimes it can be something that you have taken from medical history. However, whenever someone asks you what is the, me or any teacher for that matter, anybody asks you what should be the content of the introductory paragraph, it should be the purpose and some relevant information about the patient depending upon the context that we are dealing with. So here in our context, all of you identified it correctly. The late Horner syndrome would be fine. But never ever be like, okay, every letter when I write, I need purpose and some present condition. No. That's a wrong way to think about it. What if you're writing to a social worker? What if you're writing to the patient's teacher? So you need to be very careful. So purpose and some latest relevant information. This information, it's up to you. You decide what should it be in the intro. Okay, so I'm just writing a sample intro here. Okay, I'll write 2 samples. And we have discussed this in detail on Monday session. If anybody wants to know more about it, you can get access to the recording. Just contact the number given in this one. So you will be able to get a hold of it. Okay, so I'm writing my intro. Writing to refer Mr. Dev Singh Randhawa. I want all of you to focus here. Who is suspected to have Horner syndrome. I'm just putting HS for now. Okay. When we look at the sample, I'll write it correctly. He now requires further evaluation and management. Now requires further evaluation and management. Okay. Okay. I'll give you one more sample so everybody can have. This is one way to write, or if you're starting with thank you, you can say thank you for providing evaluation and management for Mr. Randhawa. He is suspected to have, since he is suspected to have Horner syndrome. I'm just putting HS. When we look at the sample, I will write it correctly. Okay. So take a second. Go through the introductory paragraphs. Jose, Pratima, Smita, Sindhu, Manju, Saina, Radhika, Blessy, Asma, all of you, please go through the content of the introductory paragraph. All of you. This is the content. So remember, when you are thinking about the content, think about the content like this. Then think about from your case note, what would be the purpose, what would be the latest information. Okay, and look at the samples. So we selected information, then we framed our introductory paragraph. All of you. Shinu, Samson, Manju, Saina, Anu, Ratika, Asma, Blessy, others, go through it, come on. Okay. Again, remember, latest information depends on the situation. Today, we cannot say it is a diagnosis or present condition. Today, it's the latest assessment. That is the latest information. Next week, when we discuss a case note, it can be something completely different. Okay, so depends on the scenario, what information you mention about your patient. Okay. Now, since we have planned the introductory paragraph, I want you to pay close attention. We are going to discuss something very much important to your OET writing. So, all right. So, I want your full attention here. Okay. So, we have written our introductory paragraph. Okay. So, we are done with our intro. So, when you get case notes, so that is intro is our intro we have written, and we have, okay. Now, whenever you get case notes where there are multiple visits or multiple admissions, okay, whenever your case note is about multiple visits or admissions. It can be multiple home visits or multiple visits of the patient to your facility, or it can be multiple admissions of the patient. Whenever there is multiple visits or multiple admissions involved, there are two ways that you can write such letters. Okay, you can write intro, then in latest visit. What happened? What happened during the latest visit? Okay, then after that write the past visits. Then of course end the letter. Okay? That is one way. That is the most preferred way by OET. Whenever there are multiple visits involved, they expect you to start with, after the intro, talk about the latest visit, then talk about the past visit, then end the letter. Okay. However, on the other hand, there is another way. You can write your intro, then you can talk about past visits in 1 or 2 paragraphs, then talk about latest visit, then end the letter. These are the two options that we have when you get a case note that has multiple visits or multiple admissions. You can write the introductory paragraph, then talk about the latest visit, then talk about the past visit, then end the letter. My question is, how do you know which to choose? How will you choose which structure that will be suitable for your letter? Yeah, that's exactly my question, Samson. Which one will you choose? On the basis of what will you choose it? So sometimes people will say, or I have listened, all there are many people out there saying that, if it's an urgent visit, go with the first one. Okay, so I'll number this as first one, this as second one. Okay, so I've heard people saying that if it's a urgent visit, go with the first one. If it's not that of urgent visit, go with the second one. Not always. Okay, that's a good way to think about it, but it won't work out always. Okay, you will understand why I say it once you start writing your letters. Okay, so I would say more than the urgency, always look at it like this. Okay, can I talk about? Okay, if I talk about, okay, can I talk about the latest visit first? Without confusing the reader. Okay, and one more idea that you need to think: overlap. Is there too much or too many overlap between? Is there too much of a overlap between visits? Okay, so 1 second. So whenever you think about it, you will think, can I talk about the latest visit without confusing the reader first? Okay, and is there too much of an overlap? Okay, so these are the two questions that you need to consider. Can I talk, if I talk about not latest, it should be latest. So if I talk about the latest visit first, will I confuse my reader? Then are there any too much of an overlap between the visits? Okay, so tell me one thing. Today's visit, okay, all the visit the patient had headache. I agree. First, on 10th, the patient had headache. On 24th, the patient had headache. On 29th, the patient had headache. I agree. I'm with you there. But my question is, do these visits overlap a lot? Other than headache, are there any overlaps? Come on, tell me, Smita, Pratima, Jose, Sindhu, think about it. Are there any overlap here today's visit? Other than headache, are there any overlaps? Too much of an overlap. Come on, Saina, Manju, tell me, what do you guys think?
No.
No. What? Okay. So, yeah, not exactly, right? Assessment is different. The severity of the symptoms, except headache, the severity of the headache is different. Assessment is different. In such a situation, so you can choose the first one. Okay. You can. So let me write that down. Okay, 1 second. 1 second. Let me write that down so it's clear to all of you. 1 second. Give me a sec. Okay, so you can go with the first one. You can choose the first version, first structure. No overlap. Not much of an overlap. Not much of an overlap. And if you talk about the latest visit first, logical flow, it will not confuse the reader. It will not confuse the reader. Confuse the reader. So that's when you need to choose the first version. Intro, latest visit, then past visit. So first version, there is no overlap except 1 point, no more than 1 point. No, you can say the latest visit without the support of the past visit, then go for the first version. But go with the second version. If there is too much of an overlap, which means without talking about the past visit, without talking or mentioning about the past visits, the latest one will not make sense. Without talking about the past, what happened on 10th and 24th, if the 29th will not make sense, and we cannot do that. So if you get about the past, the latest visit will not make sense. Okay, that means it will confuse the reader. So if you can say the latest visit without the help of the past visit, then go for it. Okay, so all of you take a second, go through what I've written, then I'll explain it once again. I know it might be a bit out there for all of you. Take a second. Whenever you have multiple visits, there are 2 ways that you can write such letters. The best and the most preferred one is the first version. Write the intro, mention the latest visit first, then mention the past visit. That is the best thing that we can do. You can opt for the first method if all the visits are separate, they are not overlapping, they are not, you can talk about the latest visit and it will make complete logic sense if you talk about the latest visit first, then mention the past visit, because there are no overlap between the visits. Okay, and whatever happened, the events happened on each visit is separate, it makes sense on their own. There are not too much of an overlap. Okay. All right, Pratima, Jose, Blessy, Sindhu, are you guys with me so far? You can choose the first version if there is not too much of an overlap. You can talk about the latest visit without confusing the reader. You can talk about the latest visit at first without confusing the reader, because there is not too much of an overlap between the visits. The events are different. The events are not overlapping, are not connected to each other. Then go with the first version. However, if the events are overlapping too much, what happened on the second visit is connected to the third visit, and what happened on the second visit is, third visit is connected to the second. There is too much of an overlap. That means if you go with this structure, it will confuse your reader. It will be very difficult for you to show logical connection. Then go with the second one. Write the intro, talk about the past visit, then talk about the like a story. You can go for it. That is the second version. Saina, Manju, Samson, Shinu, Radhika, Asma, Smita, Anup, and others. Does this make sense to you? Take a second. Okay.
Yes.
Okay. So we always, so whenever you get multiple visits, think about, write the introductory paragraph and think about these two versions and think, can I convey the latest one without mentioning the past? You know why I mentioned the latest and then I mentioned the past. Is it okay without any confusion? Can I present it? If your answer is yes, go with the first one. Otherwise, don't try too hard to bring this structure, because you might confuse your reader when you're writing. You will get confused. You will end up wasting a lot of time if it's too much of an overlap. If the second visit is connected to the third one, first visit is connected to too much of an overlap, then go with the second version. Okay, so nobody can tell you, you have to write the first version. That's when you will get B grade. Not necessarily. You get marks on the basis of how well you convey, how logically you convey your idea, your selected information. Okay, just because you followed this, you will not lose marks. This is a preferred one, and you are able to get this into this framework. Well and good. Otherwise, don't panic. Go with this version.
Once more, if it is overlapping.
If it is overlapping, okay, what do I mean by overlapping? When the first visit is connected to the third visit and something from the second visit is connected to the first visit, too much of connections, too much of, interconnection between the visits, then go with this version. Talk about the past visit, second visit, then the latest visit. Go with this version. Did it make sense to you? Take a second. Manju, does that make sense to you? Radhika, are you with me so far? Saina, Blessy?
Yes, ma'am.
Okay, once again, what do I mean by overlap? So today's visit, there is no overlap. The common factor is only the headache. And each visit, the severity is different. The assessment is different. The plan is different. So not too much of an overlap. However, if it's the same complaint with the same problem, that means it can get quite confusing. Okay, or without talking about the past, you cannot talk about the latest visit. Then go with the second version. Very important. This is a common type of letters that you get for your exam. Multiple visits are very common. Very common question papers. Okay, so you need to know, you should be familiar with this. So don't push yourself to write this way always. Think about the overlap factor that I just told you. Pratima, are you okay? Does this make sense? Sindhu, does this make sense?
Yes, ma'am.
Okay, all right. So don't worry. I'll send you whatever that you see on the screen. I'll send you in the virtual classroom group, so you can go through everything. And if you have any questions, you can contact me. Okay, all right. So here that brings me to our today's case note. We have already written our introductory paragraph. Let me take that up here. Okay, let me bring that down. Okay, oops. Right. Okay, we have already written.
Ma'am, can I talk, ma'am?
Yeah, sure. Tell me, Asma.
Ma'am, sorry to interrupt, but I just want to know, as you said, the second version. Ma'am, can you elaborate
Okay.
some example, like if there is
Okay,
one
so
symptom is common in all visits, how we will
one
do
thing,
that, ma'am?
okay, not only symptoms, the events are connected. Okay, imagine so many things happened on the past visit. So many things. The patient came, the patient had so many symptoms, the vital signs were unstable, there were so many problems happening on the past visit, and the latest visit is connected to those events. Maybe on the first visit, she had hypertension. Okay, and they have given in the latest second visit, they have given she is now hypotensive. So I need to talk about the past for the latest to make sense. For the latest, so okay, imagine the patient came to your facility on 10th December and she presented with symptoms of pericarditis and pneumonia or something like that. So she had infection, she had cough, she had problems sitting up, she had shortness of breath, all these problems. So you treated her, and from your facility, you gave treatment and you gave her medications, antibiotics and everything, and you sent her home. Today she's not well. and you feel like she's having a relapse. So, and you're referring this patient to somebody else. So if you just say relapse and others, if you talk about the latest visit, that is the relapse thing, will it make sense? Today the patient relapsed. She has these problems. No, you have to say what happened in the hospital and how it was treated. And now, because of all these things, we did all these things and the patient was okay. That's why we sent her home. But now she's having a relapse. Only then it will make sense. The other way around, it won't make sense. Asma, was it clear to you? Was it clear to you? Asma? Hello? Okay. Okay, you got it. Okay, perfect. Okay, so don't worry. We will be doing a case note of this format very soon. So don't worry. Don't be like, okay, we will do this today. We are doing this version. Next week or the week after that we will be doing this version. Okay, so don't worry about it. Whatever structures that I discussed, complementary case note we will be discussing. Okay, but keep this in mind. This is an option for you. Not only this. Because sometimes if you try to to force yourself to bring everything into the first version, sometimes you will lose track, you will waste time, it will not click, you will be confused. So sometimes it is okay if you follow this format. That's what I'm saying. Because everybody is like, you need to write the latest. Yes, it is good if you do that. But if you're unable to do that, if you feel like, okay, too many things are going on, too many things are connected to each other, I cannot talk about the latest visit without mentioning the past visit, then of course you have to follow the second structure. So, okay, all right. I hope I've conveyed myself clearly. If you have any questions, please ask. Okay, so I'm moving on to today's letter. So we have already written the introductory paragraph. Then I told you today we can try out the latest visit. So what were the problems on latest visit? So second paragraph.
Excuse me, ma'am.
Yes, tell me.
Last time you told if it is like a overlapping past events. Second one or first one? Second one.
Second one is too much overlap. First one, see here, go through it. Go through this one.
So here, which one we can use?
Is here, except the headache, are there any overlap?
No.
No. So what we can go with the
first one.
Okay, perfect. Got it? Latest visit. Then because all the visits she had headache. That is only the one common factor. But every time the events were different. So we can go with latest visit. It will make sense. Okay. So so today I have written my introductory paragraph. I think we are going about our second paragraph. So second paragraph, I'll talk about what happened on 29th Jan. Okay. So what happened? The patient had severe episodic attacks, right? I'll mention episodic attacks. Remember, patient had episodic attacks of what did he have? Episodic attacks of what? Come on, tell me. Episodic attacks of, go through the case note. On 29th, look here. Oh, episodic attacks of headache, rhinorrhea, epiphora. Go through it. Okay. Episodic attacks of headache, rhinorrhea, epiphora. I'll mention that. Don't worry, we will worry about the sentence. Let's look at the content, then we will worry about the sentence structures. Okay. Rhinorrhea, epiphora. Then droopy upper eyelid, right? Droopy right eye. Droopy right eye. Sangan. What else did we have? Sangan eyelids. Come on, tell me Sangan eyelids. Sangan. What? Yes, facial flushing. Very good, Saina. Facial flushing. Facial flushing. Do before and facial flushing. Facial flushing before and during headache. During headache. Then what else? What else? What else?
Noted by his wife.
Yeah, his wife noticed it. Wife noticed it. Wife noticed it. Okay. Then what else? What else is there?
Constriction of pupils.
Constriction. Very good. Constriction. And one more thing. Constriction of right pupil. You don't need to say right eye pupil. You just need to say right pupil, right? So right pupil. What else? What else? What else? One more thing. Left side of the face. Decreased sweating. Decreased sweating on the left side of the face. So we have then, okay, 1 second. So left side of the face. Okay. So you thought about, so you have written your introductory paragraph, then you wrote your second paragraph. Can I ask you something? I have written all these symptoms. Is there any way I can connect, I can bring a logical connection between the first and the second paragraph? Is there any way I can bring logical connection between my first and the second paragraph? Go through it. Can I do that? Can I bring, look at the content of the first paragraph and look at the contents of my second paragraph. Tell me, can I bring any connection here? Anything to connect the first, what is it? Yes, tell me, what is it?
I'm writing to refer Mr. Patient who has episodic attacks of.
No. I'm not asking you to change the intro. Listen to me carefully. We have wrote a very good introductory paragraph. We know the contents of the second paragraph. My question is, can I connect these? Can I use a sentence or anything to bring logical connection between these two paragraphs?
No, ma'am.
Look at the symptoms. Look at the symptoms, then look at the intro.
Symptoms suggestive.
Yes, very good, Sindhu. Very good. That's it. All these symptoms are due to, all these symptoms may be due to, can be due to, or may be due to what? Horner syndrome. I connected, right? I tried, because sometimes it's okay if you don't, but here we can connect them together, right? I'm not saying change them. I framed my introductory paragraph. Then I decided to write latest visit as my second paragraph. Then I thought, okay, can I connect these two together in any way? Yes, because whatever happened on the second paragraph, whatever symptoms he had, those symptoms are indicative of Horner syndrome. So I mentioned that. These are the symptoms. These symptoms may be due to headache, Horner syndrome. Okay, may be due to Horner syndrome. So there is a logical connection. I'm not saying you have to. I'm saying here I can. These are the symptoms that made me believe that the patient has Horner syndrome. Saina, Blessy, Sindhu, Smita, and others, are you clear? Why did I write this sentence here? Come on, think about it. All of you go through it. Manju, go through it. Pratima, Anup, Shinu, Radhika, Jose, others go through it. Any of these things I can write as my introductory paragraph, and I decided I'll talk about the latest visit. And whatever happened on the latest visit, those were the symptoms of Horner's, possible symptoms of Horner syndrome. So I thought, okay, why not? I can connect, I can bring a logical connection between these two sentences. I brought that here. Okay, if you don't want to do it, you can. Okay, now third paragraph. Let's worry about the third paragraph. Okay, so third paragraph, I'll talk about what happened on 10th Jan. 10th Jan, what happened? In January, what happened? Headache and severe right-sided headache, headache with nasal discharge, then I'll write my assessment, infectious sinusitis, right? Infectious sinusitis. Then how it was managed, assessment and management. Then the same paragraph itself, I can say, I don't need to write another paragraph. I can say, you know what, 24th Jan, how was his headache? I'll mention how bad was his headache. Okay, I'm not framing sentences now. We will worry about sentences later. How bad was his headache? Then I'll talk about rhinorrhea. He had rhinorrhea. Then his neck was tender, neck tenderness. What was the assessment this time? Then the management. Done. Then I can end my lecture. That's it. There is nothing else. Okay. We have systems analyst. Okay. That we will talk about in a bit. We'll worry about the systems analyst thing in a second. But go through it. All of you go through it. I selected my information. I want all of you to pay close attention here. I wrote my introductory paragraph by adding the purpose and some latest information about my patient. Then I thought, okay, this is a case note where there are multiple visits. So which should I start with latest visit or should I mention past visits first? So I looked through my, details, the information that I had. So between each visit, what happened, the events are very different. Only headache is a common factor. More than the headache, no other overlap as such. So I decided to go with, in the second paragraph, I thought I'll mention the latest visit. Then later on, I'll talk about the past visit. So in the second paragraph, I mentioned the latest visit. Once I mentioned it, I was like, okay, can I connect the second and the first together? Can I bring a connection here? So how did I bring a connection here? This sentence. Because I told in the first paragraph that my patient may have Horner syndrome. Why did I think of that? Because of these symptoms. So after mentioning these symptoms, I mentioned that because of these symptoms, the patient may have Horner syndrome. Then I finished the latest visit. So of course, in the third paragraph, I talked about what happened on 10th Jan and what happened on 24th Jan. Okay, Manju, Pratima, Anup, Shinu, Ratika, Pratima, Asma, others, Saina, Blessing, Smita, go through the structure. So we know how we are going to organize the letter. Okay, go through it. So another one question. What if, ma'am, I don't think I can organize the paragraph with the latest, then talk about past because I'm worried I'll make mistakes. Don't worry. Start with the, if that's you feel very hesitant, you are not sure, you're not at all confident. On the exam day, you are not confident with the first version, even though there is no overlap, even though you can organize it this way, you are not confident. You are like, okay, what if I make a mistake? What halfway through, if I fail to connect the ideas? What do? Go with the second version. If it's really, if you are not at all confident confident with using the first version on the exam day. I'm not saying when you practice. I'm saying on the exam day, even though you know that for multiple visits, there are two ways that we can organize. And even though that you know that, but on the exam day, we are not confident about it, go with the second version. Okay, that's okay. As long as you write good sentences, as long as you don't make grammatical errors, you will get marks. Okay, you need 300 or 350, you will get it. Okay, so don't put too much pressure on you on this thing, but this would be better. This is something that gets you scores. If you can identify the latest thing and connect it with the past event, that could be good. But if you're unable to, even though this is possible, you're unable to write it, go with the second version. Saina, Blessy, Sindhu, Smita, did I make sense just now? Did what I told just now, did it make sense to you guys?
Yes, ma'am.
If you're but not when you're practicing. When you practice, try these things. Try if there is no overlap, if you can very well explain it by talking about latest, then moving on to the past, go for it. But on the day of your exam, if you're too confused, sometimes it happens. You're under a lot of stress and your writing is the third exam, right? After listening, reading, then writing comes. So sometimes you will be stressed or you will be panicking. Then go with the second version. Don't worry about it. Because of that, you will not lose your grades. Okay, so it is better to go with the first version. It is always better to go with the latest one. But if it's not happening, that's okay. That's completely fine. Okay, so take a second. We have organized this letter using time references. We went from the latest time references to the past. Are all of you clear with the structure? Are all of you clear with the organization so far? Shall we look at the sample letter now, if that's okay?
Yes, ma'am.
Okay, get ready. We are I'm going to show you the sample. Yes, okay, so whatever grammar that we have learned this week, I've tried to apply it. I've used past perfect. I've used simple past. Look at the this one, the time references, everything. All of you go through it. 1 second, I'll show you. I'll show you on the screen. Okay, all right. Okay, this is how your letter should be. Look at the layout. Go through this. Then we will analyze the sample in a second. Go through it. Go through the layout. Take a second, go through it. Then we will analyze it. All of you. Zoom in. If you want, zoom in. What we just discussed, I have wrote that into sentences. And look where I have placed the systems analyst thing. All of you. And don't worry, if you are in the virtual classroom group, I'll send you the sample letter. Whatever you saw on the screen, I'll send everything. if you are in the virtual classroom. Read everything. Okay, let's analyze it. So if you haven't finished reading, we'll analyze it. Okay, let's focus on the first paragraph. We already discussed, I'm writing to refer. If you want to start with thank you, you can do that. If you want to start with I'm writing to request, you can do that. If you want to start with thank you, or it would be this one, I'm writing to request, or with the patient's name, you can do that. All those things we discussed during our Monday session. Okay, all right. So I'm writing to refer Mr. Tej Singh Randhawa, who is suspected, or see, relative clause. All of you can see the use of relative clause. Who? We already discussed this grammar one. Who is suspected to have Horner syndrome. He now requires further evaluation and management. So instead of writing the date, I wrote 2 days ago. Latest. This is the latest time reference. Okay. The theme of this paragraph is latest visit. Okay. So latest 2 days ago, Mr. Randhawa, I squeezed in that systems analyst information here. Okay, Mr. Tej Singh Randhawa, a systems analyst, presented with episodic attacks of severe headaches, rhinorrhea and epiphoria. He had a droopy right eye and sunken eyelids. These symptoms were initially noticed by his wife. If you want to write his wife, Miss Mona, you can write, not a problem. He was found to have facial flushing before and during headaches. His right pupil appeared constricted. How was his right pupil? His right pupil appeared constricted under dark lighting, and he experienced decreased sweating on the right side of his face. Then look at the next sentence. I want all of you to look at the next sentence. I brought a connection between these two paragraphs by using the sentence. These are the symptoms consistent with, matching with. Okay. 1 second. I'm seeing your messages in the chat. I'll answer it that after I explain it. Definitely I'll answer it. Okay. So all these symptoms are consistent with, see, logical connection between two paragraphs. It's not compulsory. Okay. I'm not saying, don't be like Anjali ma'am told us we have to bring connection with first and second. No, I'm not saying that. If there is an option for that, go for it. See, logical connection between two paragraphs. I can do that. So I did it. Okay, that's it. Connection between the two paragraphs. See, with that sentence, see, earlier you told we believe the patient may have Horner syndrome. Why do we believe it? Because of these things. Let's see, Sindhu, Smita, Radhika, Pratima, Manju, Saina, Asma, others. Are you clear with these two paragraphs? Shinu, Samson, clear?
Clear, ma'am.
Each and every sentence clear, right?
Yes.
Okay,
Yes.
perfect. We are looking. Yes,
Consistent with, ma'am.
Consistent with means, okay, when something you're not sure about it. Okay.
Ma'am, sorry.
Yeah, I'll tell you. I understood what you're asking, Asma. I'll write it down. Okay. When you have symptoms that matches with it, we are not sure. So when you say consistent with, when you suspect, when you suspect something, but you're not sure. So these are the symptoms. These are the symptoms that make you believe that the patient may have Horner syndrome. So you can say the symptoms consistent with or suggestive of. Okay, that is an option. Okay, 1 second. Consistent, matching. Consistent means matches. All these symptoms matches with Horner syndrome. We are not saying the patient has Horner syndrome. We are saying the symptoms that we saw 2 days ago matches with or suggestive of Horner syndrome. Okay. So instead of consistent with, you can use suggestive of. Or one more thing, you're like, ma'am, I'm not comfortable with consistent with. It's too confusing for me. I don't know. Give me some other way to convey. Possibility, I'll give you in a second. Okay. Or you can say, other than, you can use consistent with means matches with. Or you can say these symptoms. Okay. These symptoms may be due to Horner syndrome, or these symptoms, still it means possibility, right? These symptoms are possibly due to, Remember, possibly due to. But consistent with or suggestive of means matches with. This is what it suggests. We are not sure about it. This is what it suggests. Okay. So I'm not saying all of you need to write consistent with, but if you don't want to write it, I'm giving you other options. And don't worry, we will have a session on talking about possibility. So we more details we'll discuss there. Okay. But see for second paragraph, latest visit, and see the time reference I've used 2 days ago. Now, okay. Let me ask you something, Saina. What happened 2 days ago and what happened on 10th and 24th? Are they the same type of events? Are they the same? Everything was same? Was it same, Saina? What do you think? Were they similar? What happened 2 days ago and what happened on 10th and 24th? Are these events the same? Do they match? Exactly, do they match? Saina, Manju, what do you guys think? No, they don't match. They are not similar. Okay. So here there is a similarity. There is no similarity. They are different events. That's why I used however. I used however to show. However to show contrast. How different it is to show contrast. If they were similar, what happened on the latest visit and this visit were the same things? Then I would say similarly, but it was different. I used however. I formed a connection. However, so all this happened 2 days ago, but or however, on 10th January. See, did I, okay, all of you say, look here, I only wrote 10th January. Did I write 2017? Did I write 2017 there? Radhika, Blessy, did you guys see that? I did not write 2017. Why not?
Yes. No, ma'am.
Why? Because the same year. So whenever, if your dates are, if your dates are have the same year, if the dates in the body paragraphs, body para have the same year as today. That means the day you're writing the letter, you don't need to repeat the year. This is not my opinion. This is what OET has told. You do not need to repeat the year. You do not need to repeat. If it was 2016, I would have repeated it, but it's the same year. Today's date and the year for all the other data are the same. So I did not repeat. You don't need to repeat the year. Okay. All right. All of you got that? Okay, this is not my opinion. This is not something that this is something that OET has told, that if the year is same, you don't need to repeat it. So that's why I just wrote 10th Jan. I did not write 10th Jan 2017. Then I wrote Mr. Randava came with. Earlier I told presented with. Now I'm saying came with. I used something different. Okay, here it was presented with. As you can see, earlier it was when I talked about the latest visit, I used presented with. Here I used came with. Different verbs. The complaints of right-sided headache and significant nasal discharge. His assessment had revealed. Smita, Saina, what tense is that? Had revealed infectious sinusitis before he was prescribed Augmentin. Blessy, Saina, Smita, what tense is it? What tense is it? Past perfect. Past perfect. Very good. Past perfect. Yes, past perfect. Correct. Those who are new, don't worry. We have recorded this session. We discussed past perfect on Tuesday. So we have already discussed. Okay. That's why I used past perfect. Then, so I talked about the first visit. Now I'm like subsequently. Okay. After 2 weeks. So again, I did not use the date here. I used after 2 weeks. He visited again. So now I'm saying visited. First I said presented. Then I said came with. Now I'm saying visited again with intermittent episodes of persistent, severe, throbbing right-sided headache. Full stop. It was radiating to his right eye, teeth and jaw. He was unable to stand still, sit down or go to bed. He also experienced rhinorrhea and the right side of his neck appeared to be tender. Okay. Then again, okay, Blessy, can you read the next sentence for me, please? This sentence.
After he had been assessed to have cluster headache, he was treated with the acetaminophen and non-steroidal anti-inflammatory medications.
What tense is that? Again, what tense?
Past perfect.
Past perfect. Okay, those who don't know about past perfect, don't worry. We had a session on that. And if you need access, I'll tell you at the end how to go about it. Okay, so this is what we did. Okay, now I've completed everything. I ended my lecture. Okay, Radhika, can you read the ending for me, please? Can you read the ending for me, please?
Yes, ma'am. In view of the above, it would be appreciated if you provide evaluation and management for him. Please contact me if you have any questions.
Okay, so here, if you provide is wrong, it should be if you could provide. I just messed up there. Let me just write that down there. So it should be if you could provide, okay? If you could provide, okay? If you could provide evaluation and management for him, please contact me if you have any questions. So in view of the above, what is the meaning of that? After you write everything, you're saying taking all this into consideration. That's what it means. In view of the above means taking all this into consideration. If you don't want to write that, that's okay. You can leave that. Okay, but it means in taking all this, once you have written everything that the reader needs to know, you can use in view of the above and say taking all this into consideration. Taking all this into consideration, I've ended my letter. Okay, so instead of, so you're like, ma'am, everybody uses in view of the above. I need something else. So see, you can use given the above, or considering the above. Considering the above, or one more, I'll give you one more. Considering the above, or in light of the above. And remember, before above, you write the, not after it. So in light of the above. So you can, all these means taking everything I have said into consideration. That's how you write it. And I know my reader's name, so I used yours sincerely. I did not imagine any name. I did not write my name. They only gave head nurse, so I wrote head nurse. They have given any other details about the writer, so I did not do that. Okay, so all of you take a second, go through it. All of you take a second, go through it. Every single, don't worry about past perfect tense, don't worry about possibility. We have already discussed past perfect, and possibility I'll be discussing next week. So you, those who have been joined, you can get access to the recordings. I'll tell you how in a second. Those who need to know about possibility, you can come, you can join next week. So grammar aspect, don't worry, just go through it, all of you, every single thing. So, and this, the theme of the next paragraph, the third paragraph was past visit. What happened on the past, what happened? So, how did I arrange my paragraph based on time references? What happened during the previous visits? That's the theme here. So, whenever you get a letter where there are multiple visits, you have two ways to arrange it. And I told you how to make the decision, and I told you, what are the things that you need to take into consideration. Then, if you write, you can write like this. So, what if these three visits had a lot of similarity? Then, instead of however, I would have used similarly. But there were no similarities as such, so that's why I used this one. However. Except headache. So you will say, ma'am, headache was the same, except that there were no significant, similarities. So that's why I use however. Okay, I use however to show contrast. Okay, all right. 1 second, let me just arrange this in a way that it will become clearer to you later. All right, so all of you take a second, go through every single thing on the screen, every single thing. And if you have any questions, please unmute yourself and ask me. Okay, two different things. Intro, latest visit, what happened, then this is the ending. Okay, and please remember, I have not told you that if there is an ending, it's compulsory to use in view of the above. No, it's your decision. Nobody can tell you you have to write in view of the above. No, that's your decision as a writer. And none of the OET official samples they have used in view of the above. It is something that people like using it. That's why if you don't want to use it, skip it. No issues. Okay, nobody can tell you you have to use. No, it's a choice. Once you have told everything, before you write the ending, you can say, considering taking everything into consideration, it would be appreciated if you could. It's not if you provide, it's if you could provide. Okay, I'll correct that and I'll send you the group. Okay, all right. So go through everything, all of you go through everything on the screen. So Blessy, Radhika, Sindhu, Asma, Shinu, Anup, Pratima, Manju, Smita and others. Is this clear to you? Are you clear with how to organize? What are the different ways to organize? And are you clear with Tate Singh Randhawa case?
Yes.
Okay. All right. So that's what that is. That's what that is. Okay. Now I would like to tell you something. Okay. I'd like to tell you something. Our approach. What was the first thing that we do? What we did today? We read the first sentence. First sentence of the case note. Remember, I asked I asked Saina to tell me what is my role as a writer. We read the first sentence, identified the patient, and our role and your role as a writer. That's what we did first. Then what did we do? We read the writing task. Okay. So our writing task. Then what did we do? After you read the writing task, you try to identify. Type was given. Check the type. Sometimes it won't be given. Check the type. Then we identify the reader. Okay. Then whether the reader is known. Sometimes if the reader is known, it will be given. Whether the reader is known, is known to the patient. Then we checked for the purpose. Okay. Purpose. Then then we read the case note. Understood every single detail. Understood every detail. Okay. Then after that, we select. Only then we selected and rejected information. Okay. Right. Then after we selected and rejected, the first thing we did that is wrote the intro. Write the intro. Then we thought about the organization. After writing the intro, think about organization. So initially itself on the day of your exam, don't panic. Write the intro, then think about organization. Then we thought about organization and wrote the letter. Organization and body paragraphs. This is exactly what we did today. And this is something that I would recommend that you do every time you write the letter. Smita, Radhika, Blessy, Sindhu, go through this. What I've written on the screen right now, this is exactly what we did today. Okay, we read first sentence, we understood who is our patient, what is our role. Writing task, we check the time, we check the reader, we check the purpose, then we read the case note. And please do this. This is very important. When you read the case note, do not select the information. It will be too much going on at once. Read the case note in detail, then select and reject information. So, I know on the day of your exam, they have given you 5 minutes to do it. You might take 8 minutes. That's okay. 8 minutes. Say you took 8 minutes for this. Okay, that's okay. Nobody can force you to what to do, right? When you so during the reading time, you cannot write anything. So first 5 minutes plus take on two extra minutes to do till here. Then before you worry about the organization, write the intro. Then think about organization, because always the most difficult part of a letter is write the intro, then the second paragraph. Once the second paragraph clicks for you, you will write very well. I'm 100% sure about it. So first thing, write the intro, then think about organization. Okay, all right. So that's what that is. Okay, so those who want to take a screenshot, feel free to take a screenshot of what's on the screen. This is something that I'd strongly recommend. Okay, those who want to take a screenshot, that's okay, go ahead and take it. Okay, so we have covered a lot of things today. Let me just, tell you a few things. So today, so we have, yes, Radhika, tell me.
Ma'am, is it necessary to write full name in the
Yes,
purpose?
it's compulsory. It's compulsory. It's compulsory. Okay, that
Because
is.
we are already writing in the reference line, right? Patient full
No,
name.
yeah, that is there, but they've asked us. I confirmed it. They want you to write full name. Okay.
Okay.
All right.
Okay,
Okay.
ma'am. Thank you
Okay.
so much, ma'am.
Okay. Let me tell you a few things. Okay. So that brings me to, we have already orientation sessions I've recorded and we have it with us there, with Gia ma'am. So recorded session for orientation, for reading. I handle reading, listening, writing, right? So for all these 3 sessions and even speaking, Richa ma'am speaking as well, we have orientation which are recorded. It will be available to you if you join virtual classroom. Once you join virtual classroom program, it will be made available to you. Okay, once you join virtual classroom, so in-depth orientation on all the modules. So certain things that I told right now, Radhika's question, writing the name, writing the layout, when to write yours sincerely, when to write yours faithfully, all these things I've discussed in the recorded orientation session. So I would say for you to get access to it, join virtual classroom. And once you join virtual classroom, you will get access to notes, sample letters, everything, but you need to join the virtual classroom. Okay, so writing, reading, listening, all the 3 modules, all 4 modules, and speaking, if you want access, you need to join virtual classroom. And our posters or Instagram or Facebook posters, or Insta or Facebook, you can find contact details. Okay, this will be okay. And Monday, Tuesday writing sessions, and Saturday writing session, Thursday, Friday. So let me write that down. Monday, Tuesday, Saturday, it's writing. Okay, it's writing. Then Tuesday and Thursday, we also have speaking. Okay, speaking. I think it's afternoon. Richa ma'am. Okay, speaking by Richa ma'am. Okay, all right. Then, if I'm not wrong, bear with me here. Then, okay, Wednesday, Thursday, Friday, you have reading and listening. Reading and listening. I try to get as many latest materials as possible, everything we discuss during these days. So this is the timetable. Once you join, you get access to everything. If you are not in the virtual classroom, you will not get access to all these things. Okay, but sessions are free. I think this week, next week, I'm not sure. We will put that in the website, or in the Insta or wherever it is. We will update if next week is also free. Okay, but if you want to get access to all these things and access to all the sessions, all the recordings, everything, and these sessions are also recorded. Okay, all sessions are recorded. Once you join the program, you will get access to everything. Okay, so that's what is. If you want, just go through it. Any questions, please ask. Okay, so if some of you might be only participants in reading listening group, if you want to become participants in virtual classroom, you need to join. Okay, all right. So that's it for today. I will send you this case note. Today's sessions are recorded and will be available in YouTube. Okay, today's session, it will be recorded. It will be uploaded in YouTube. That's it for today. Smita, Manju, Pratima, others, any questions for me before I wrap up? Okay. Thank you so much. I hope I was able to convey myself clearly to all of you. Please check our website and Facebook, everything for further updates. We have sessions every day except Sunday. Okay. I'll see you guys next week. Thank you so much. Okay. All right.